Did you choose to do flat closure after your mastectomy, or are you considering it? I've been wanting to make a video on flat closure for a while now, but with me having implants, I couldn't exactly do this from my own experience. This video is a Q&A with a friend of mine, Nancy, who chose this option. I think you're really gonna like this candid conversation, not just about flat closure, but also touching on this whole cancer experience. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. Let's first make sure we're on the same page with what flat closure is. With a mastectomy, excess skin, fat, and other tissue are removed. The remaining tissue is then tightened and then smoothed out so that the chest wall appears flat. Another term for flat closure is called post-mastectomy, chest wall reconstruction. And lastly, doing flat closure for surgery is also known as going flat. What are some common reasons that women choose flat closure? To avoid excess procedures that come along with reconstruction, not wanting anything foreign in your body with breast implants, a dissatisfaction with a previous reconstruction and then doing an explant surgery, having large breasts before your mastectomy and not wanting to replicate that with some sort of reconstruction. And lastly, you may just have a preference for flat closure. Let's get into our discussion.
I actually started researching and reading as much as I possibly could. And my diagnosis and my treatment protocol was happening very quickly.
You did chemo first.
I did, but I didn't know that. So from the time that I found a lump in my breast until the time I actually started chemo was only 1 month.
Okay.
And so there were a lot of things in between, having to think through plans, protocols, and all of those things. And so the internet, of course, our best friend in all of our research, welcome, is really incredible. But every story that I read about anybody that was sort of around my age who had been diagnosed with cancer, it seemed like they had surgery first. So I was preparing myself that surgery was going to be first. I had not met with any of my medical team to know what my treatment protocol would be.
So you were thinking you needed to figure all this out because you thought it was going to be happening sooner than it actually was.
Yeah.
Was lumpectomy ever on the table for you? Or was it for sure mastectomy right away?
I think we talked about that as one of options, but it was not an option for me. They tell you that your breast has quadrants.
Yes.
And so I had cancer in multiple quadrants. And in that case, lumpectomy would not have been an option for me.
You wouldn't have got clear margins if they did
Exactly.
that. Okay. So let's say you know you're not doing lumpectomy, you're doing mastectomy. How are you deciding single versus double?
That also wasn't actually on the table as a question. We really did not talk about an option of 1 or 2. The option was like, if one, what? Do you have reconstruction? Do you do flat closure? And because I started chemo first, I actually had the plastic surgeon and her fellow came to meet with me while I was in my first chemo day.
Okay.
It was like the day of all of the specialists. It was so much information to take in. The one thing that was really nice is that because this was all happening during COVID, I actually was able to have my partner there for that very first chemo day so that they could be part of all of those conversations.
Right. I was actually going to ask how Leanne, like your wife, how she gave her 2 cents, or you know what I mean? Were you guys talking it out, or were you pretty decisive that this is what I'm doing and just bouncing it off of her?
I think we both did our own research, quite honestly, in some ways. It was really, the meeting with the plastic surgeon was incredibly important. It was really about my case. And so what would need to happen in conjunction with the other parts of my treatment protocol, because I was not only taking chemotherapy, I was going to be on some targeted therapies for the long haul.
Because you were HER2 positive.
I was estrogen and HER2 positive, And I also was going to have radiation and surgery. And so the plan was originally chemo, surgery, radiation.
Okay.
And radiation needs to happen within a certain amount of time post-surgery. So because of that, their opportunities to do reconstruction are within that window. Because once you have radiation, then of course, as we know, your skin starts to change, it starts to toughen, it becomes much more challenging.
Yeah, it's like you can reconstruct after radiation, but your options are different had you not done radiation.
Yeah, and because the skin is less malleable, they just
Yeah.
don't have, you can't keep expanding, as
Right,
an example.
right, yeah.
You know, once you're
Right.
in that protocol. I can't imagine going through that with radiation at the same time. If you were still expanding or
Expanding,
something,
yes.
you know, I think that could be
Yeah.
hard. But again, I don't
I
know.
did that, but it was, I don't know, once you decide that that's what you're going to do, it
just-
just seemed like, well, this is what I'm doing.
Yeah.
Yeah.
Whenever you're faced with a consideration of a mastectomy, you're sort of given the range of options.
Sure.
And for me, the range of options was either having reconstruction or having flat closure.
Right.
And everything in between.
Right.
And I don't think I really knew where I sat on that spectrum, quite honestly, at the beginning,
Oh, okay.
because I don't think you live your life thinking about this.
Sure.
Until you're faced and confronted with a diagnosis where
right.
you now have to
Right.
actually think this
Right.
through. The plastic surgeon basically shared with me that, one, my breasts were small. Thank you, I did know that. But that implants are only made usually for augmentation. So there actually was no breast implant that I could have without augmenting my other breast.
I looked this up recently because
Yeah.
we were talking about this. And so when I, Googled, and it said about 125 cc's is the standard smallest, and then it looked like you could get 85 to 95, something in and around there. But then these are 310. So even if you did a third of this, that might still be bigger than
Your other
your native
remaining breast.
Right.
Yes.
So that is probably true, right?
Yeah. So that was one piece. But then they also described that because of the kind of breast cancer that I had and because of the way that they were going to do the surgery, they would actually also need to take muscle from my back.
Oh, the lat flap one?
I didn't do more research once we decided not to go into that, but the muscle from the back. And I was also diagnosed not only with breast cancer, I didn't know at the time when I was making these decisions, but I also then was diagnosed with pancreatic cancer. And so we did know that there may be other surgeries in my future. And
Which there were.
Yes. That were pretty intense.
Yes.
But I think for me at the time, I'm not a good medical person on any day.
Yes.
Being faced with a diagnosis like this, you get thrown into it all. I couldn't imagine actually having more surgeries
And
than I needed for my care.
Yes, you're signing up for that, you feel like, versus whatever you're having for the mastectomy is what you're having, and then you're going to do that. But anything, I think, above that, it does feel like you're signing up for more.
In a lot of the reading that I had done, I really read people's holistic stories, people who had chosen to have reconstruction and loved it, people who had chosen to have reconstruction and then had complications, and then eventually, sometimes even 15, 20 years later, had made decisions to
go
have
flat closure then.
Yeah. And then I also read about people's stories who had chosen from the beginning that they wanted to have flat closure.
Yeah.
And one of the things that really stood out to me, which scared me, I think, the most, was that even when people had made that choice, sometimes that wasn't always honored.
Yes.
And so I really ensured that my whole care team was alongside me, that this was what we were doing. And even in the morning of my surgery, where you're in pre-op and you're like with your whole nursing team, and my surgeon had come in, and I was like, okay, remember, like flat closure, right? And she was like, yes, flat closure.
Yeah.
So it felt to me like I just needed to continue to reinforce that, because there had been some times and comments, based on my age, that I might at a later date rethink this and want to have reconstruction. And I think because we ended up having the time, quite honestly, as much as it is to say that chemo gave us time, because I didn't have to make that decision in that first 2 weeks.
Yeah, and you could reiterate, this is what I want.
Yeah. And I could go back, and Leanne and it gave us the time to talk about it, and she was very supportive in terms of my decision. But actually, the research also led her there. She was supportive and a bit relieved.
Yes, that you were making the same decision.
Yeah. Because I think that can be harder, if you aren't aligned.
Yeah.
And of course, it's your choice and it's your body, and you absolutely get to make that choice, because nobody can make it for you.
Sure, but it's
nicer.
still nice to feel supported in whatever decision you're making.
Yeah.
In terms of your surgery, was it your surgical oncologist that did the whole surgery, or does a plastic surgeon come in at all to do the flat closure part of it?
No, there was no plastic surgeon involved in the surgery. because I didn't do reconstruction. So my understanding was this plastic surgeon would have come in if that had been part of the surgery. Because I had cancer also in my lymph nodes, what was so amazing was...
How many again?
I had 3 that they had tagged.
Yeah.
They actually removed the 3 lymph nodes, did pathology on them while I was still in surgery to determine if they still had cancer or if they didn't. And they didn't. So then they only removed those 3. They didn't need to do like the third of
Because it'd be probably an axillary dissection if those were still positive, and then they would want to get more.
They would want to make sure that that wasn't part of my... that I didn't still have cancer in my lymph nodes. The other thing that was really interesting was, when you're doing research about this, you learn about, do you keep your nipple? Do you not?
Yes,
keep your
I
nipple?
wanted to ask you about that.
Okay. Well, I had, of course, never really thought it was an option. It wasn't an option for me in my situation because the breast cancer was in so many different places. So again, they didn't want any margins. They didn't want to risk
that was similar to me,
putting that back. But what was fascinating was that when I had done the research, I also learned that your nipple would feel different even if I had kept it.
Sure.
It wasn't an option for me to keep. But because it's not actually attached to the nerves.
So the sensation isn't there, and even if you're cold and it becomes more erect, like it doesn't have the same sort of response.
It doesn't.
In terms of incisions, some women with a mastectomy will have their lymph nodes removed through a separate scar in their underarm. So is your incision your mastectomy incision plus one in the underarm, or is it one?
It was one. So I have one cut that goes into my armpit.
So about where would it start?
Here? Probably basically where your boob starts. And it's just flat across, but it goes up.
It curves up.
It kind of curves into my armpit, which does make it difficult for certain things because there's more like tension in the armpit now. That you just have more flexibility on the other side. Whereas this is like, you can tell that there's like skin's been brought together, so it's tighter. For me, it looks straight, but I do think it goes up
curve,
and curves up into my armpit. That is actually where it's the most tender, is the part under your armpit. And my medical team advised me that that would be the case, that the part across your chest would actually become less tender, for lack of a better word, over time. But that part under your armpit, just because of the, I don't know, the sensitivity of that area generally, it's more...
It is definitely a more sensitive area.
And even over time, when other parts feel less sensitive, that still has not changed. You know, and you expect over time things will really resolve.
They don't.
But you're totally again, it's just like the things that you're aware of. I mean, that was the biggest thing for me around energy. When somebody on my medical team shared with me that you take the day that you started treatment to the day that you end treatment, whatever that is, 90 days, a year and a half, whatever. 3 years.
Longer,
And then you add that. And that is when you may start to feel kind of like yourself again. In terms of energy and recovery. And that was really helpful for me to prepare other people. Because people would think, oh, you're done chemo, you must be feeling great now. And you're like, okay. And then I had surgery 6 days later. So yes, feeling absolutely fantastic. And then you have radiation and you become more tired months post-radiation versus just when you're in radiation. And so again, it's like the compounding effect that people, I think it's very hard for people to understand. We're not used to that.
And I didn't know before.
How do you know?
Going back to incisions, well, let's give context of how many years out are you?
4.
Because I was a year after you. Okay,
4.
So you're 4 years. Has your incision changed much, your scar, or even with radiation? For me, I have a double, one side was radiated, so there is a different side to side.
You have like control and test. You get to like see what radiation does.
Science-minded person, I love that. But do you notice radiation changes?
I had an excellent surgeon.
You did. Your scar looks really good.
Is amazing. I was very impressed. I, again, don't do well with medical things, so when I had to take off that, like the full bandage right after, that was really rough for me because I could see, you know, it's closed, but it's like still kind of like a little bit open. It's long. That was I did not do well. I almost passed out in my bathroom when that happened.
When I saw my scars the first time, looking back in retrospect, it's just because I was in that mode of treatment mode. Okay, what's the next thing? So I kind of looked at my scars the first time and the day of my mastectomy, and I was like, huh, that's interesting. But I didn't have any emotional reaction. Did you have an emotional reaction at all, or was it delayed? Mine was delayed.
I think mine was delayed also. I definitely mourned the loss of my breast. More actually my nipple. It's funny. It is funny because it's not just because it's your breast with your nipple. It's like when you look down at yourself. It's just, I still have moments. And I also, of course, you probably do as well, have the radiation tattoos.
Yes.
So there's all of these things that remind you.
3 more, yeah.
Of this experience every day. So there are times that I mourn it more than others, I think. But I definitely had some tears to be shed after my surgery. Not because it would have changed having flat closure.
Yes,
it just was the loss of a limb. I kind of think of it that way. I think people are a bit nonchalant, oh, it's just a boob. It can be removed, so thus it is.
Yeah.
And I think if it was your arm, you would have a lot more to say about it.
Yeah. Even with implants, there's still a loss. I have boobs, but they're not I don't say they're mine. I had skin sparing mastectomy, so no nipples, so they still feel, I said this in earlier videos, they feel external to me, and I thought over time they would, it's almost like I'd incorporate them into my body more. No, they're still totally external to me. So there's still a loss, even though I have boobs.
Right, because this is the thing. It's not just about a boob.
Yeah.
Right? And I think that it kind of is treated like that sometimes.
Yeah. If you had larger breasts to start, not even a B, like a D plus, right? Do you think that would have changed your decision in any way? So let's say if you had single mastectomy, flat closure, so now there's a much bigger discrepancy side to side.
I don't know, because I think a big part of the reason why I made the decision was also the multiple surgeries. I really did not want to. And because I had already been through chemo, my body was not in a great state going into surgery. You were already beaten down, it feels,
Yeah.
And so the idea of then having expanders and having to go through that and having everything kind of be more medical throughout that whole period of time between the surgery and radiation, when I already felt like I'd been through so much medical. I just needed that time also to heal. And prepare myself and prepare my body, quite honestly, for radiation, because that was going to be sort of the next onslaught, So I don't know. I can't, I have never had breasts that large, so I don't know what that would feel like.
It's more of an assumption of, if I were in that position, what would I do? Or some women will have same thing, one-sided mastectomy, flat closure, but then some sort of balancing surgery or reduction on the other side. I'm just curious, because you did one-sided, if any of that
I think
would
for
play
me,
into it.
It felt really sort of sacred to not do any surgery on the breast that didn't have cancer.
I remember you said
and that was still going to be there.
Right.
If more surgery was in the future for that, I don't know, I probably would have had similar conversations with myself and with my wife around what that plan was, because a lot of it was based on sort of it just felt to me let's not touch something that ain't broke.
Sure, and
which I know sounds weird.
No, I know what you're saying. But if you're going to do another surgery on the other side for some sort of balancing, then are you thinking, do you just want to do the same thing on both sides? If you were going to do another surgery anyway, do you know?
Well, and in that case, I probably would have had a more in-depth conversation with my surgeon about whether to do a double mastectomy in that case.
Right.
Or if I still felt really strongly that flat closure was the option, because I can absolutely imagine it is more challenging. The idea that you're signing on for future surgeries is real when you're young, because even if you do have implants, there will be future surgeries.
I know.
And
I've already had 2, so now I'm gonna have 3, and
my
and then what?
Non-joy of medical things. That for me also was a significant barrier. I did not. want to project future surgeries on myself because I really, really do not like the medical things.
Yes. I wanted to circle back because we were talking about your consult with your plastic surgeon, and I know there was more detail with your family doctor and the advocacy, because I think anytime you're going through cancer treatment, it's so important to advocate throughout treatment. But I think especially if you're doing flat closure, because you want whatever outcome that you have to be meeting your expectations. Yeah. Right?
Nobody's going to advocate for you like you. Nobody's going to follow up with you like you. Nobody's going to, you're just going to be on somebody else's to-do list. And for you, this is your life. And there was some, not questioning within my medical team, but there were a few times that I thought that my decision around flat closure was being questioned. And so that was really where I brought in my full healthcare team to advocate and really leaned on my family doctor to talk through my decision. And to also have my doctor write a letter of support acknowledgement, so to speak, to my medical team that I was making this choice, that I understood the consequences, that I was really decisive in my decision.
And then it's in your clinical notes that this is what the patient is requesting.
I did feel vulnerable at times. And because I had also read in media, sadly, that there had been people who had had surgery and had been just as resolute about flat closure and then woken up with a flap because for future possible changes in their mind. And I think that that's just a very different choice, and I really didn't want, because I didn't want more surgery. No more surgery. I really did not want any mistakes. And you are not awake, so it's not like you
can't say, okay, hang on, are we good here?
It is a very emotional thing, and it is also not something that ends. It's not.
Well, I don't think any of this stuff ends. I didn't realize that.
But it also, even if it's done, whether you have implants or you have flat closure, you still know, you see it every day. You are reminded. There are shopping mishaps. I was trying to buy a black tie dress. And let me tell you, to find a black tie dress that has straps, coverage that allows for an insert. Oh my gosh, it was just really hard. And so you sort of encounter these things at various stages along the route. And people will be like, oh, no, of course there are black tie dresses. Of course you can find them. You can. But it's like 1 out of 10. It comes up with bathing suits. It comes up with tank tops. It comes up with even sometimes like low cut, like shirts that have like lower sleeves or something.
Let's talk more about
practical things.
Bras, bathing suits.
The first thing that I had like silicone.
I was going to ask you what options you tried.
I'll call it my silicone boobie. You really couldn't wear that quite like close after surgery because the skin was, even inserted into a bra, I found, because it was heavier and it was sticky when you got hot.
So that's right on your skin, or that's
it's not. You can. I think you can. I shouldn't say this. I think you can have ones that go right directly on your skin. But mine, I still put it into a bra that had a pocket. I also didn't feel like it really looked like my boob. So
the contour was different?
Yeah, like the contour was different, and like to get them to match, it felt like I had to do a bit more. Also because it was heavier. In some ways I was like, I feel like it's heavier than my boob. So like it would like pull like a bra down. So that for me felt weird. So I started with those. I still used those for other things. Sometimes I would put them in my bathing suit as an example because it was silicone.
Because your bathing suit was pocketed, so you'd put
my bathing suit was pocketed. Yes, I had one bathing suit randomly from before cancer that did have a pocket, so I tested it kind of like in that one. That was one that was very triangle-y. And I would joke that like I looked probably pretty normal standing. But then the minute I like leaned over, you're just like, there's no boob there. Then I found this incredible website, and it's a nonprofit both in Canada and the US and maybe in other parts of the world, called Knitted Knockers. And I was so excited about this because they're these like really sweet, actually knitted boobs, and they come in every size, and you go onto their website and you put in your information, and they, free of charge, have volunteers who have been making these across the country in various sizes and colors.
Yeah, they do have multiple colors.
So those are all made with organic Pima cotton and then stuffed with cotton batting. And then you also can get one that is made with acrylic that is for swimming, so that it can...
Yeah, it's called Aqua Knocker or something like that. Yeah. I looked it up, yeah.
So I thought, I'll just try this because it's free. I'll just get one.
Yeah.
See how it goes.
Yeah.
And you get it. It's not necessarily perfectly like your breast, because even if you're all the same size, you know, in the same size, you might have different ones. So you take out the cotton, you can add a little cotton, like it just to make it shape kind of. And I often find like the first week when I have a new one, it just needs a little bit of time. It's a little bit too perky at first, but then it kind of just like...
Yeah, they look pretty good. Like it looks
I feel
pretty matched.
I feel pretty matched. And I feel like the nice thing is that I have full control. The way that they're knitted, it kind of knits to the top. So there's a little, it's not like a long nipple, but it just like kind of creates like a nub in the middle, so that there's some structure, I think.
Yeah. Okay, so let's talk about when you're wearing it. So you're wearing it in bras that are typically pocketed already. It's not necessarily a mastectomy bra, it's just whatever bra, and then I'll put that up on the screen too, the one that you typically wear. And then those bras come with some sort of insert, like any of us, if we're buying a bra, like there's often inserts in them.
Yeah.
And then you're keeping that insert in on both sides, and then you're putting the knitted knocker behind that.
Yeah.
So it's like the contour is still almost like
there from the
matching.
cup.
Yeah. But then it's like filled.
Exactly. The luxury of not having incredibly large breasts is that I can basically buy bralettes, is what I've found to be the most comfortable and easiest.
Yeah.
I think if your breasts are larger, you probably will need to have some of the more
like
formalized, structured,
and,
like mastectomy bras.
Yeah.
But because of that, I do really seek bras that have cups. As you have described, it's really an easy way to maintain the contour. That way, then it also, you can't see the seaming in the knitting.
Because you have that thing and you have the insert in front of it.
This past summer, I was like, I really should try to find a bathing suit. I kind of been delaying on the bathing suit front. One of the things that I love are like rash guards.
Yeah.
Also, I didn't really want my shoulders to be exposed, especially because I had radiation.
Yes.
So, I think the big thing in most bathing suits is that your shoulders still are really exposed. So I was looking for more of a t-shirt kind of top. And lo and behold, most rash guards, not all, but you can buy a ton of rash guard t-shirts or one piece, like kind of like what surfers wear with like shorts that have inserts. So you just look in the description on most things, it will say removable cups. That is the first thing I do now when I look for any bra or now bathing suit.
Right.
If it says it has a removable cup, I'm like, that means it has a pocket.
Right.
And so that's sort of the indication for me of how I can quickly filter through, because there's even a ton of bralettes out there that don't have pockets.
True.
So it was a really simple way of like, if it says removable cup, okay, I'm in.
Yeah.
And so I was able to get a really great bathing suit.
And the knitted knockers, you can wash them?
You can wash them.
Yeah. And do they get more worn from the washing?
The stuffing is what I often have to like fix a bit.
Yeah.
I find that I replace them about once a year.
Okay.
And because I only have a single mastectomy, I always order the pair, because then I have them in different bras, and just in case if one is wet, because I don't dry it in the dryer, I just let it to sit on top of my dryer.
That makes sense. I mean, I guess if the knitted knocker is in your bras already, I'm just wondering if you ever go flat on one side, like if you're out or even at home, are you wearing a bra ever with nothing in it?
That's a good question. I definitely kick around my house without a bra on.
Yeah.
I rarely go outside without a bra on, to be honest. After surgery, I did not wear a bra for a long time. Like, I want to say almost 6 months, maybe. Also, I was still in treatment, so I didn't really care. Not that I didn't care, but I wasn't like out living my best life.
Yeah.
Not like where, when life returns to normal, you're like back in like your working environment and everything, or your social environment or your family life environment, whatever the case may be.
Do you find that when you're out and about or at work sort of thing, and you have it in, it's not a thing, but if you went without, would that bother you?
I think so.
Yeah.
I mean, it would bother me. It depends on the context. Like if I'm literally on a walk,
Yeah.
I might not think of it
Yeah.
so much, but I wouldn't go to work without one.
Yeah.
I just, that for me, I feel like then I'm drawing attention. I think I would feel like I'm drawing attention to something that I don't really want to draw attention to.
Right.
I might respond very differently if I had had like a double mastectomy flat closure.
I think so too.
Because
that's my assumption.
because there's not the difference in size. And women's clothes, tragically, sadly, in many ways, are really designed to have breasts in them. When I don't have one, it almost concaves in
I
more
meant to ask you about that.
than if I just previously had not been wearing.
So some women with flat closure can be flat, some women can be actually concave, and then some can be convex, meaning there's extra tissue and skin. But when I look at your contour, it doesn't actually look concave, like it looks pretty flat, right? But in clothes, I know exactly what you're saying because you showed me, and it does look like it's more like sunken in, just because of the comparison of side to side. Is there anything that, if you sort of looked back in retrospect, that you would have done differently, specifically with your flat closure surgery?
Well, I did have an excellent surgeon, and so my flat closure, thankfully, has been everything I could have asked for, you know? So I feel
your
very
outcome
lucky.
did meet whatever your expectations were. It was
probably exceeded it. I couldn't have imagined how seamless, like even now the scar is flat. I always imagined it might be raised or something, I don't know. The part that was the trickiest, which my surgeon told me this too, was the part under the armpit, and even that has kind of mellowed. So it's not like when I put my arm up, everybody can all of a sudden just like, they can see the scar, whereas
it does look very flat. How about if you had surgery and you weren't happy or content with your outcome and you had extra skin and flaps and tissue, you know, because you also don't want surgery, more surgery. So
has that come across? I don't love surgery. I absolutely would have had conversations with my medical team to really get it to a place that I would feel comfortable with moving forward. You know, if there was some reason, like medical reason, that they couldn't make it as flat as they wanted, or you know, then I may not be able to sway them. But at the same time, I would really like to understand if the outcomes weren't what we had sort of talked about going in. And you know, my understanding from my surgeon was that because we were so clear, we knew exactly what we were doing going in, that actually flat closure is an easier surgery than even leaving a flap or another kind of surgery where then the plastic surgeon is also coming in and being involved. So it felt like mine was, the choice of flat closure was actually in some ways the simplest for the surgical procedure.
I also think with your body type that there isn't as much extra, so it may be easier to achieve
flat closure
with certain body types.
Absolutely. And I think, again, you know, ask these questions to your surgeon in advance. I think that's really important. And I remember I had many conversations with my surgeon about the surgery and just trying to set my expectations and my understanding of what was going to happen and what it was really going to look like. And
so I never asked this, but I would have in retrospect, like before after photos, or did you see any of that?
I didn't ask that, but I should have. And I think I kind of relied on the internet, quite honestly, for most of that. I think I had a pretty good sense of what flat closure should look like going into it, but not everybody would have access. Not everybody would have looked for that necessarily. So
if your medical team didn't necessarily show you any photos, did you go into any of your appointments with a photo that you found online to say, like, this is what I want? Or it was all in words that
it was
you're
all
saying?
in words. Yeah. The one thing that I had taken from the internet was the like specific wording. I could never have sat here at the beginning of my cancer journey and told you what we're talking about is called a flat closure, ever.
Sure.
I think I would have just called it having reconstruction or not.
Right.
So I actually leaned on the internet for the very specific wording of like an aesthetically flat closure to make sure that that was what was like, that's what I was confirming with my surgeon. That's what was getting put in my notes.
Right.
That's also when I did some advocacy with my family doctor. That also was how we captured it in the letter, because there was good information in the ether around how to be very specific about what this kind of surgery is. So I think I learned that. I didn't know that at the beginning. And I'm not sure that anybody said to me aesthetic flat closure.
Yeah.
I don't remember.
Because I knew I was going to do reconstruction, they wouldn't have presented it to me as an option, right? But I think in some surgeons will actually present it as, because flat closure is technically a type of reconstruction, right? Versus like reconstruction or not.
Right.
But sometimes they'll say, these are the options: implants, autologous reconstruction, or flat closure. And some women are going into their surgical consults where these are the types of reconstruction, but flat closure isn't necessarily mentioned. But then if that's what you're choosing, or remember how you just sort of that vulnerability with everything, right? And so if you're sort of asking for something that really wasn't on the platter of things that you can do, those are harder decisions to almost advocate for those things that wasn't even
and it's
going to be an option. Or it could be an option, but it wasn't presented to you.
You might not even know it's an option then.
Yeah.
Right? And I think that's the hard piece of advice, but it's nobody's going to care about you as much as you care about you. This is a terrible thing to put back on patients, but at the same time, we need to educate ourselves when we were diagnosed. So we need to do as much as we can to learn as much as we can about the options as possible. I think, I'm not saying again that it should only be on us.
Sure.
There is absolutely onus on our medical teams, but in my case where we were chatting about the plastic surgeon or not, the plastic surgeon wasn't involved in mine. So if my only conversation about reconstruction was with the plastic surgeon, the plastic surgeon was probably not putting that on the table, flat closure as an option necessarily.
Sure.
Although I did talk about flat closure, quite honestly, with the plastic surgeon, but that was maybe more me prompting like questions around that.
Right.
Again, I don't even know that I knew the words flat closure at the time.
Right. I found it interesting that we chose very different things for reconstruction, but we were both equally as decisive making, like it wasn't like instantly flat closure, but it's like you came to it pretty quickly and then we're just almost like confirming as you went. And so I knew what I was going to do pretty instantly, a double with implants. There are many more women in the middle trying to figure this out. If you're watching before your surgery, what are some things to think about in a sort of general sense?
For me, part of the research really uncovered more about what reconstruction with implants would be. And that created a place that I kind of disassociated myself, honestly, from my breast. I realized that my breast that I was going to be losing was not the breast that I would be bringing to life through another method, whether that was reconstruction or flat closure. That it was, or through a prosthesis or whatever the case may be. That I was never going to look down at my chest again and see the same two breasts that I had seen for all of the years before.
Yes.
And I think we can become really emotional about our bodies in a real way. That's important. But I think for me, kind of disassociating the emotion from what would be the future was really helpful in making my decision, one way or the other. Nobody can make the decision for you, but there's a place that you're going to need to get to that you feel like you can decisively make a decision. And whether that's knowing all of the options, that was really important for me, that I felt like I knew all of the information for all of the options.
Yeah.
Even if I wasn't actually going to do reconstruction with the plastic surgeon and go down that route, I wanted to have all that information. I could have just as easily said to my medical team, like, I don't need to meet with the plastic surgeon that day because it was the first day of chemo and there were a lot of other things. But
I think it was good that you went though, because it's also, if you have that consult and you know more about reconstruction, then I think your decision for flat closure, it's almost you feel more assured because you're like, oh, I really don't want those other things. You know, it's like you probably knew you didn't want those other things, but when you like really know you don't want those other things, then the other decision can make even more sense.
I agree. I think, you know, we were both quickly landed where we wanted to land, but I do understand being in the middle and not knowing, because again, this is not something that we typically have to think about.
Yeah.
We aren't just
You're not
going
thinking,
through our lives.
if I get breast cancer, I wonder what I'll do.
Regardless of the size of your breast or not, I still had two.
Yes.
To start with.
Yes.
You know, and I think it's also a really personal decision.
Yeah, I think it's really, like Nancy said, sifting through all the information and then really figuring out what is the best decision for you.
Yeah. Not easy.
No.
But you'll get there.
Yeah.
And sometimes the surgery date forces a decision.
True.
You know, you just have to get there faster.
Yeah. Thank you for doing this.
Oh my gosh, my pleasure.
I hope this video has been helpful for those of you considering flat closure. Every step of the way, I always wanted to hear from other women who had gone through similar experiences. If you had flat closure already, consider writing a comment. What would be helpful to know if someone is considering this? Also, if you wear a prosthetic, which ones have you tried and which do you prefer? See you in the next video.